Okay, so this entire thing is called your cranium. The top is your neurocranium. The bottom part is your viscerocranium. We're going to start with the sutures. You have your coronal suture and you have your sagittal suture. Where those two meet is called your bregma. The very top portion of your skull is called the vertex. Now if you go down, you come back here and you meet the lambdoid suture, and where the lambdoid and sagittal suture meet is called your lambda. Now if we turn to the side here, where your temporal, parietal, and occipital bone meet is called your asterion. And this is your temporal bone. Now where temporal, frontal, parietal, and sphenoid meet is called your pterion. Not really sure how you say that. Now where your frontal bone meets your nasal bone, it's called your nasion. Okay, so we know that this is your nasal bone right here. This is your maxilla. This is your zygomatic bone. This is your orbit. And here you have your lacrimal bone. Show it to everybody. Green is lacrimal. And in here the red is your ethmoid bone. Okay, so if we go like this, we look inside the nose, you'll see the sphenoid also. You have the orange, which is your vomer bone, and it's not colored, but you'd also see in here, it's called your perpendicular plate. The blue parts is called your inferior nasal concha, or concha, not quite sure how you say that, but yes. Now if you look here, where you'll see the beginning, I believe that this is called your internal acoustic meatus. External, sorry. External is on the outside, internal is on the inside. This is external acoustic meatus, your styloid process, and your mastoid process. And that kind of completes on the outside. So now we're going to move on to the inside. So these impressions, everybody can see them. The impressions are the impressions on the parietal bone for your middle meningeal arteries. Middle meningeal arteries. Yes, and there's also, usually you'll see a parietal foramen here for your emissary vein, but that's not here today, so I guess it really doesn't matter. Here, this spongy part of the bone is called your diploe. I think that's how people call it. Diploe is right here. And am I missing anything, guys? I think that's really it.
I agree.
Okay. So, we're going to continue on to learn the different fossa. You have your anterior fossa, middle fossa, and posterior fossa. Now, starting at the front, you have this little hole in here. This is called your optic canal. Optic canal. Okay, optic canal for everybody right there. Optic canal. And that's located in your sphenoid bone. So everything I'm covering here is the sphenoid bone. Optic canal. You look under here, right here, this is your superior orbital fissure. Superior orbital fissure. Like this one. Right?
Are you pointing to a hole or pointing to
Thank you.
Yes.
Superior orbital fissure, what I'm pointing in. That's what superior orbital fissure. Here is you have your foramen rotundum. Foramen rotundum. Right? Foramen rotundum. Here, right here, is your foramen lacerum. Foramen lacerum. It's the more medial one. Lacerum's more medial. And when you come out, you have your foramen ovale. So lacerum's medial, ovale is lateral. Okay?
Where's rotundum?
This is rotundum, right here. So rotundum, lacerum, ovale. And then right behind ovale is spinosum. So oh, that sucks. oh well. So spinosum, ovale, lacerum or lacerum, rotundum,
Superior orbital fissure,
and optic canal. Okay, so we have all of those, right? Now we're gonna move. We're gonna move back. this one right here, and this is good to remember because if it's in the temporal bone, most likely it has to do with your ear. So this is your internal acoustic meatus. Internal acoustic meatus. And if we flip it, you'll see like this is external, this is internal. Okay? So then we move back here. This is called your jugular foramen. And that makes sense, right? Because you need your, what's that thing? Jugular vein? Yes, your external jugular vein to come up into your cranium. This is your jugular foramen. What's this one?
Internal acoustic meatus.
Okay. So then now we have, yes.
You have two jugular foramens?
Mm-hmm.
Is everything symmetric on both sides? So like there's two?
Mm-hmm. Oh, yeah, for the fossa, there's two of everything. Hi, Dr. Gulo.
Oh, Dr. Gulo.
Yes. Did you want this?
Thank you.
Okay, so this one is your hypoglossal canal. The first one, like the more anterior one, is your hypoglossal canal. And then this is your condylar fossa. Hypoglossal canal, condylar fossa. Hypoglossal canal, condylar fossa. And if you flip it back, you'll see that like the hypoglossal canal is like it's more clearly anterior. You see that like hypoglossal, and this one's condylar. Okay? So I don't know if there's anything that I'm missing. Oh, this right here. This one is your what is it, Jojo?
That or the
This one.
Mastoid.
Mastoid foramen. Oh, right behind your mastoid. Okay. So mastoid foramen. It doesn't really come. Oh, there it is. Not really. I don't know. Mastoid foramen. That's what it is. And I think that's really it. And foramen magnum. Foramen magnum. That ends everything for the foramina. Now, quickly, I'm going to tell you what this area is in your sphenoid bone. So this entire portion from here to here is called your sella turcica. Thank you. Brain fart. Sella turcica. So we're going to start from front to back. So this first part is your tuberculum sellae, and this is your dorsum sellae. Tuberculum sellae, dorsum sellae.
Well, that's the only part they're referring to when they have those?
Tuberculum sellae, dorsum sellae. And right here is called your hypophyseal fossa, which houses your hypophysis, or it's called your anterior pituitary gland. So, yes. Then you have these things. This is the anterior, it begins with a C, and I can't remember what it's called. Anterior clinoid. Thank you. Anterior clinoid process. And this
is it anterior or posterior?
Well, this one right here appears anterior, and this one back here is posterior.
Okay.
Yeah. Yes. So anterior clinoid process, posterior clinoid process. And I believe that is it. Am I missing anything? Anybody? Oh, yes. Thank you. So this is your ethmoid